Stephen Thompson was born on November 18, 1959, to a loving family of 7 in Bishop Falls, Newfoundland. Stephen worked on his family fishing boat for much of his teenage years, and at the age of 20, he decided to move to Alberta. Growing up, Stephen was quite the romantic. It was his dream to get married and to start a family he could call his own. In the summer of 1986, his dream finally came true. That is when he finally married his best friend, Natasha. The couple was married for 23 years before Stephen fell ill in the summer of '09.
Hey, hon.
Hey, what are you doing? Oh, just watching Duck Dynasty.
Can I watch?
I guess. So, honey, I've got something to tell you. I haven't been feeling well lately.
What do you mean?
Well, I have problems peeing. Like, I can't start peeing. Like, it takes me a minute. And when I pee, it burns, and sometimes there's blood in my urine.
Blood in your urine?
Yeah.
Okay, well maybe we should go see a doctor and get it checked out.
I think that sounds good. So, what's going on, doctor? You did a whole bunch of tests. Did you figure out what's going on with me?
Well, Stephen and Natasha, based on your test results, I have to inform you that you have stage 2 prostate cancer.
No.
I know you guys are feeling a million emotions right now, but I know with the proper treatment we can get you through this.
Okay, Dr. Pehl, can you explain to me then, for both my wife and I, what prostate cancer is and how it's affecting my body?
Well, Stephen and Natasha, I just want to say that prostate cancer is the most commonly diagnosed cancer among Canadian men. And in order to understand the prostate cancer and how it affects the body, we must understand the normal physiology of the male reproductive system. This picture here represents a male reproductive system. Its main role is to produce sperm and deliver it to the female reproductive tract. The prostate is a small walnut-sized gland that sits anteriorly to the rectum and inferior to the bladder. The prostate will then secrete a seminal fluid, and the purpose of this fluid is to protect and nourish the sperm. When a man is diagnosed with having prostate cancer, the normal physiology of the prostate will become altered. Stephen, do you mind if Dr. Pehl explains to me how he screened you for prostate cancer?
Oh, sure.
I screened your husband by using a rectal examination and a transrectal ultrasound. By using the ultrasound, I was able to determine if your husband's prostate was enlarged or not, and indeed his was.
Rectal examination is when she stuck a finger up me and felt my prostate for any abnormalities.
When the cells become cancerous, they present the following features. 1. They start dividing uncontrollably. 2. Abnormal structures can start to form. And 3. Abnormal cells can obtain the ability to move to other parts of the body. Since Stephen has been diagnosed with stage 2 prostate cancer, I suggest that we go for surgery, which is called a prostatectomy. This is when we remove the full portion of the prostate, and hopefully that'll get rid of all the cancer cells. If not, then our next step would be radiation therapy.
Well, you've given us a lot to think about, and we'll get back to you as soon as we can.
Well, thanks for coming in.
Thank you.
In conclusion, Stephen decided to treat his diagnosis with surgery. As of 2015, Stephen remains cancer-free, and the couple is more in love than ever.
Guys, it's Steve's mustache here at Jim Bob, and before you guys leave, I just want to tell you a few things about how prostate cancer affects the key concepts. So, homeostasis. The prostate can become enlarged and affect surrounding accessory organs in the male reproductive system. Usually this is where symptoms would typically present. For example, if a tumor starts to grow and swell, it can put pressure on the bladder, and this is where you may experience an increased feeling of urination. Cell membrane. The prostate is made up of different glandular cells. Once abnormal cells have become cancerous, they can start to form tumors within these cells, therefore causing alterations in the normal physiology of the cell membrane. And finally, proteins. There are risk factors that can help influence the development of the disease, which are 1. Age, 2. Diet, 3. Race, 4, heredity, and 5, hormonal influences. Hormonal influences play a key role in the disease. It is shown that men who have prostate cancer usually have higher levels of IGF-1 protein in their system, and this stands for insulin growth factor 1.